Next, a hearing on encouraging enrollment for health insurance provided by the Affordable Care Act.
I want to call to order Subcommittee on Oversight. Thank everyone for joining us today. We are holding this hearing virtually. If you didn't realize it, in compliance with the regulations for remote committee proceedings pursuant to House Resolution 965. Before we turn to today's important topic, I want to remind members of a few procedures to help you navigate this virtual hearing. First, consistent with regulations, the committee will keep microphones muted to limit background noise. Members are responsible for unmuting themselves when they seek recognition or when recognized for their 5 minutes. Second, members and witnesses must have their cameras on at all times. You need to step away from the proceedings. Please leave your camera on rather than logging out. Third, we will dispense with our practice of observing the Gibbons rule and instead go in order of seniority for questioning, alternating between minority and majority, beginning with members of the Oversight Subcommittee first. Finally, without objection, Representative Chu is authorized to serve as chair in the event that I have some technical difficulties or whatever. I thank you all for your continued patience as we navigate this technology in order to continue serving our country together in this great time of need. And with that, I'll now turn to the important topic of today's hearing: maximizing health coverage enrollment amidst administration sabotage. It sounds like a movie. So good morning, everyone, or good afternoon, rather. Our hearing today will focus on access to health coverage and the Trump administration continued unconscionable sabotage of America's care. Since its passage over a decade ago, Republican leaders have treated destruction of the Affordable Care Act like Captain Ahab treated the white whale. Since 2011, the other side has voted more than 70 times to eliminate the ACA. Unconscionable sabotage. In 2017, they even held an outdoor party at the White House after passing a plan that would cause millions to lose their health care coverage. That same year, one of the gravest abuses of power in this era, in the dead of night, Republicans came within one vote of ending the ACA and remaking 1/6 of the American economy on a bill they'd introduced hours earlier. The president recently bragged about his health care. Of course, he has great coverage paid for by all of us, by the same taxpayers who stand to lose their protection if the administration succeeds in the courts. They've never let up. I just want to remind everyone, the administration is in court right now demanding to destroy the ACA. The administration is fighting to remove health care programs and protections from millions during a pandemic. They're using virtually every tool to dismantle the healthcare system. They have greenlit scam junk plans without any protections. They've imposed the gag rule to prevent women from having access to reproductive health care. They have gutted funding for navigators and assisters. While failing to crush the ACA, they are destabilizing the American health care system to a breaking point. The administration has gone out of its way to prevent Americans from getting and maintaining coverage. Between February and May of this year, 21.9 million workers lost their jobs. Of these workers, 5.4 million became uninsured due to their job loss. In March, I joined my colleague, Health Subcommittee Chairman, Lloyd Doggett, and nearly 100 House members calling for a special enrollment period for people to seek ACA marketplace coverage during the COVID-19 pandemic. Even during the pandemic, HHS refused, likely dooming many Americans to suffer. No other word that I could think of except sabotage. We keep seeing the administration and my friends across the aisle swear up and down they support protections for pre-existing conditions. They assert with a straight face while spending 10 years attacking the ACA. Let's repeat, the Republicans have sought to terminate pre-existing protections over and over and over again. It's on the record. In welcome contrast, some states are working hard to expand access to coverage. One of them is the great state of New Jersey. We have witnesses today from New Jersey, Colorado, who will discuss how they are making the ACA work best for their citizens. As Senate Republicans race to confirm a new justice, they are downplaying their challenge to the ACA. If the Republicans have changed their minds on the ACA, why would they join us in defending the law? When we voted in June to protect the ACA, 177 of 179 Republicans opposed it. If you don't have a calculator handy, that's 99%. When given a chance, 99% of our colleagues across the aisle voted against protecting pre-existing conditions. We know why. In just a few short weeks, the Supreme Court will hear the ACA case. The future of our healthcare system hangs in the balance. And I want to yield now to my good friend, the ranking member, Mr. Kelly of Pennsylvania. And I'm going to keep it to 5 minutes because we saw it happen the last time. Two people went over, Republicans and Democrats. We talk too much, Mike. Okay, so Michael, you're up.
Thank you, William, and thanks for holding me. This is really a tough time, so I think all our thoughts and prayers go out to anyone who's lost a family member or a loved one during this virus. There's nothing been more devastating in our time than the China flu. And during this time, the cost of healthcare is on the minds of almost every American, so I appreciate the opportunity to really discuss the issues today. Now, while far from being perfect, our healthcare system is the best in the world. And with a hearing like this, I'm also reminded of how fortunate we are to live in a country with access to the most innovative healthcare on the planet. Now, I hope we can use this hearing to put things in perspective and correct some of the myths about the American healthcare we have been hearing we're having a hearing on the campaign trail. Today, I want to talk about two things. First, I want to talk about some successful healthcare policy developments we've achieved over the last couple of years. And second, I want to correct the record on some of the rhetoric we've been hearing about American healthcare. A lot of this rhetoric seems designed to scare the American people in advance of an election. And I think that effort has been both unfortunate and very misleading. The idea that this administration has sabotaged our healthcare system, if that's the truth, this is the worst sabotage the world's ever seen. It has been. I can't actually look at this and say, come on, if we're really going to fix this, let's fix it. Let's not talk about things that sound good on the campaign trail but ring hollow when it comes to truth. We've made some very positive progress on stabilizing the ACA's exchanges. Insurance premiums are down, coverage choices are up, and enrollment is stable. So in addition, this administration has made many strides towards being more affordable healthcare options to Americans who may not want, need, or be able to afford some of the ACA's coverage plans. So I'm pleased that we have Chris Pope here with us today. He can speak further to some of these successes, including the restoration of short-term healthcare plans and major enhancements to health reimbursement accounts. Now, these crucial events or reforms have actually provided options to family, letting them choose what's best for them. Again, emphasizing letting them choose what's best for them and not having something shoved down their throat that they don't have a choice in. Now, let's also remember that by getting rid of the individual mandate, we've saved lower and middle income taxpayers at least $695 a year. And that's huge when you look at that group of people. Now, Democrats have been trying to block these efforts, and I understand why, and also using scare tactics to stop the progress of this administration. Well, what tactics am I saying or talking about? Well, like saying that Republicans would eliminate coverage for people with pre-existing conditions, which couldn't be further from the truth. On protecting pre-existing conditions, Democrats won't take yes for an answer. Makes no sense to me, but that's where we're at. Now, let's remember, the first legislation offered by Republicans in the 116th Congress said no one, and I mean no one, should be charged more or denied coverage based on their pre-existing conditions. Democrats rejected that offer, apparently to try to preserve it as an election issue. So any suggestions that Republicans won't fight to protect Americans with pre-existing conditions is just flat out wrong and a great miscarriage of the truth. Meanwhile, instead of working together on bipartisan efforts to improve our healthcare system, 118 Democrats have co-sponsored Medicare for All. This new and enormous program would destroy our current healthcare system, starting with the repeal of the Affordable Care Act. Sadly, many Democrats simply want an unpopular and partisan government takeover of healthcare when we should be working together to low costs and coverage for everybody and get more options to the American people. Now, this one-size-fits-all approach is absolutely wrong. It doesn't make sense to anybody other than somebody trying to push an agenda the wrong way. Now, the plans that will take away choice from hardworking Americans in my district would also destroy their health care options. The Affordable Care Act is 10 years old. Much of that law has changed over the last 10 years on a bipartisan basis. Yet Democrats keep looking to the past rather than working together to improve the future for our American people. But we can build on recent successes in healthcare policy by continuing to bring down premium prices and by increasing coverage choices for all Americans. The key is increasing the number of options available, and people can actually buy something that fits their needs and something they can afford. Now, I hope we can stop all the fear mongering on this issue and come together in the near future to work on bipartisan reforms that will improve the lives of our constituents. Mr. Chairman, I want to thank you for holding this hearing, and also want to thank all our panelists for taking time out of their lives to come and talk with us. So thank you so much, and I yield back, sir.
And say to you and to all the Democrats and Republicans who were on last week with our last hearing, not this hearing, I thought going over everything after the hearing, tremendous questions from both sides of the aisle on the subject of taxation, tax fairness. I think that, you know, it's tough to get people together before an election, but I want to compliment both sides for doing what I think was a spectacular job. We're next going to hear from our panel, and thank you to our distinguished witnesses for taking the time to appear before us today to discuss this very important issue. I'll introduce our witnesses and then turn to each of them for their testimony. Our first witness is Commissioner Marlene Caride. She is the commissioner currently leading New Jersey's Department of Banking and Insurance. Previously, she was a member of the New Jersey General Assembly, representing the 36th Legislative District. Our next witness is Kevin Patterson. Mr. Patterson has served as the Chief Executive Officer of Connect for Health Colorado since April of 2015. He has a long history of public service, including as interim chief of staff to Governor John Hickenlooper. Our third witness is Andy Slavitt. Mr. Slavitt currently serves as the board chair for United States of Care. Previously, he was the former acting administrator for the CMS. And our final witness is Chris Pope. Mr. Pope currently serves as a senior fellow at the Manhattan Institute. His research focuses on healthcare, payment policy, and insurance market reform. Each of your statements will be made a part of the record in its entirety. I would ask that you summarize your testimony in 5 minutes or less. To help you at this time, please keep an eye on the clock that should already be pinned to your screen. If you go over your time, I will notify you with the tap of my gavel. Commissioner Paridi, you may begin.
Thank you, and good afternoon, everyone. Thank you, Chairman Pasquarello, Ranking Member Kelly, and members of the committee. As mentioned by the chairman, my name is Marlene Caridi, and I am the Commissioner of the New Jersey Department of Banking and Insurance, and we regulate the banking, insurance, and real estate industries, and now operate Get Covered New Jersey, the state's official health insurance marketplace, which launched this month. Under the leadership of Governor Murphy, New Jersey has led in protecting the Affordable Care Act, stabilizing its insurance market and increasing access to coverage based on the guiding principle that healthcare is a right. The state has moved in a deliberate way towards where we are today, opening our state-based exchange, making coverage more accessible and affordable for our residents, and providing more financial help than ever before for those purchasing coverage on our marketplace starting this open enrollment. In 2018, the state enacted two major policies. We took first in the nation action to continue a requirement to have coverage after its elimination from the federal level. And we implemented a reinsurance program beginning with plan year 2019 to cover high-cost claims, reduces rates in the individual market. The two laws resulted in health insurance rates in the individual market that were 22% lower than they would have otherwise been. The state decided to establish its own marketplace in order to better secure access to affordable quality coverage for our residents. The fact is that while we have been sending funds to Washington for the use of the federal marketplace, we continue to see policies enacted that threaten the progress made by the Affordable Care Act and made our work more challenging. From 2017 to 2018, enrollment in the individual market dropped for the first time since 2014 and continued to drop the following year. When New Jersey took control of outreach and enrollment assistance in 2020 as a state-based exchange on the federal platform, we began to reverse that trend. Get Covered New Jersey will open for enrollment on November 1st and will keep more than $50 million in our state to strengthen the marketplace. Residents will see benefits that include new state subsidies on top of premium tax credits. The estimated average subsidy for an individual would be at least $578 a year and at least $2,313 a year for a family of four. The average net monthly premium for those eligible for financial help is estimated at $117 a month for 2021, compared to $164 a month in 2020. Increased navigators to provide free enrollment assistance with $3.5 million in funding 16 navigators, up from 1 navigator under the federal government in 2019. 3 months to enroll compared to its 6-week window under the federal government. And residents will also benefit from our ability to respond to the needs of the state with a special enrollment period, such as for COVID-19 and qualifying life events, including pregnancy, which improves maternal health, which has been a focus of this committee, as well as a focus of the First Lady of New Jersey. We have taken deliberate, progressive steps to stabilize our market and improve access to coverage, all leading to the establishment of our marketplace for this open enrollment period beginning November 1st. With the public health emergency we are facing, we believe there is no better time than now to make this transition. Chairman, thank you for the opportunity to speak before you and your panel.
Commissioner Caride, I am very honored to see you again. You happen to live in my district, right?
That's correct.
How to get that commercial in. Our next witness is Kevin Patterson. Mr. Patterson has served as the Chief Executive Officer of Connect for Health Colorado since April of 2015. And of course, he was an interim Chief of Staff to Governor Hickenlooper. Mr. Patterson, please.
Thank you, Mr. Chairman. Chairman Pasquarello, Ranking Member Kelly, and subcommittee members. Thank you for the opportunity to submit testimony on behalf of the insurance exchange in Colorado and the people who rely on getting their coverage through the individual market here. Again, my name is Kevin Patterson. I'm the CEO for Connect for Health Colorado. Our mission is to increase access, affordability, and choice for individuals, families, and small employers purchasing health insurance. I'm proud of the innovation and collaboration in our state to steadily reduce the uninsured rate and increase enrollments. I'm pleased to share more with you today about our achievements as a state-based marketplace and how this unique position allows us to expand healthcare coverage to the people of Colorado. Since we opened for business in 2013, we have helped hundreds of thousands of Coloradans get the coverage they need to protect their health and livelihood. However, Colorado's path to increasing access to affordable health care and choice started years before the passage of the Affordable Care Act. In 2006, a bipartisan group of state lawmakers created a commission to study models for comprehensive reform under then Republican Governor Bill Owens. With the passage of the ACA in March of 2010, our state legislature passed a bill creating the Colorado Health Benefit Exchange as a public nonprofit entity that has a bipartisan legislative oversight committee. Board members are appointed by the governor and both Democratic and Republican members of the legislature. I joined Connect for Health Colorado as CEO in April of 2015 when the state's uninsured rate reached a record 6.7%, one of the lowest in the country. Charged with further increasing access, affordability, and choice for our residents, I knew we had to prioritize meeting people where they are. So whether I'm having a conversation with a single mom in Denver or a farmer on the Eastern Plains, I and the rest of my marketplace team are listening and learning from Coloradans about viable solutions for accessing healthcare in their community. Generally, every fall, I visit many rural communities around the state to hear from them and share the upcoming open enrollment period. This year, these challenges of face-to-face visits are leading me to have these conversations virtually. I'm thankful for the opportunity to still see our partners, community leaders, and local policymakers outside of Denver. Since our inception, we have funded our Navigator program, or what we call our assistance network, at approximately $2 million a year in about 45 sites. They are integral to our success enrolling customers and providing health insurance literacy. Our assistance sites have also built relationships with small businesses, regional hospitals, and surrounding communities. Their work is vital to our ability to reach especially vulnerable populations, including families with low income, disabled population, immigrants, and folks in rural corners of the state. The ongoing public health emergency has also underscored the value of our relationships with local counties and flexibility we wield as a state-based marketplace. In mid-March, we made the decision to open a special emergency enrollment period in response to COVID-19. In early April, the Adams County Commissioners informed me that their constituents were still experiencing hardships as a result of efforts to combat the coronavirus. We listened and we decided to extend our emergency special enrollment period through the end of the month. Our assistance network and brokers were ready to field questions from those unexpectedly without coverage and help them enroll. As a result, over 14,000 individuals enrolled in coverage during this emergency special enrollment period. We continually explore ways to expand coverage with policymakers and advocates. We will be integral in the implementation of 2 new programs that passed the Colorado legislature this year: the Health Insurance Coverage Easy Enrollment Program and the Health Insurance Affordability Enterprise. I'm excited that we can extend access to affordable health coverage for Coloradans with the simple act of checking a box. I'm also looking forward to greater stability and cost due to the reinsurance program, especially for consumers who do not qualify for financial help and are still struggling to access coverage. With job loss and income instability at an all-time high in our state, it is more important than ever that we remove barriers to healthcare by providing portable and affordable healthcare options like those offered through our marketplace. Amidst the challenges we face every year as a state-based marketplace, I'm encouraged by the fact that we have flexibility, crucial relationships, and proven capability to ensure our residents have and access the coverage that they need. Thank you.
Well, thank you very much, Mr. Patterson, for summarizing your remarks. I deeply appreciate that. Our third witness is Andy Slavitt. Mr. Slavitt currently serves as the board chair for the United States of Care. Previously, he was the former acting administrator for the CMS. Mr. Slavitt.
Chairman Pascrell, Ranking Member Kelly, members of the committee. I'm Andy Slavitt, the former head of the Centers for Medicare and Medicaid Services and board chair of United States of Care. Founded in 2018, US of Care represents a movement of nonpartisan citizens, former policymakers, and experts who are committed to working so that every single American has quality, affordable health care regardless of health status, social need, or income. Before I continue, I want to please recognize the late Chairman Lewis for the great service to this nation. Thank you for inviting me to testify on the status of the Affordable Care Act. We sit at a perilous moment in our nation's history and for millions of American families. The global coronavirus pandemic has taken hundreds of thousands of American families in a matter of mere months. As many as 14.6 million people have lost their health insurance coverage, along with their jobs, at a time when the health of each American is more connected than ever before. Unfortunately, COVID-19 is not the only threat Americans are facing right now. Rather than support Americans through these trying times, the Trump administration has added to the uncertainty facing Americans by attacking the very existence of the Affordable Care Act. The ACA serves two main functions: patient protections and affordable care. The law provides every single American a guaranteed set of protections, including prohibiting insurance companies from discriminating against them on the basis of a pre-existing condition, and outlaws insurance companies from stopping coverage due to arbitrary annual or lifetime limits. The ACA has provided coverage to tens of millions of Americans through expanded Medicaid and the ACA exchanges. This quite simply has been life-changing. The ACA is saving Americans $4,000 per family, and many now can afford their prescriptions and to see their doctor for the first time. And the ACA saves 12 million seniors an average of $2,200 on their prescription medication and eliminates the age tax that made insurance unaffordable to Americans 50 and older. Rather than implement the law as Congress intended, over the last 4 years, this administration has undermined the law with a clinical callousness. These actions have included cutting funding for navigators who assist people enrolling in coverage, as well as other outreach and advertising by 90%, shortening the open enrollment period, illegally attempting to end payments owed to insurers to discourage them from participating in exchanges, promoting insurance plans which have substandard or limited benefits, which raises the price of insurance and brings back the fine print gotcha policies that kept so many people from getting the health insurance coverage they thought they purchased. When I served in the Obama administration, I had responsibility for administering the laws passed by both Democratic and Republican-controlled Congresses. I understood that I had a duty to implement the laws passed on by Congress to the best of my ability, that the executive branch did not get to choose which laws we liked and which we didn't. But not so with this Trump administration. They have taken this to a new level now by refusing to defend the people in a case brought by Republican attorneys general to invalidate the Affordable Care Act and take their health insurance. The public now faces great uncertainty as to the future of this law, just as a deadly and serious virus is making its way almost completely unchecked through the country. The effect of the lawsuit, were it to be successful, would put 130 million Americans in a situation where they could be uninsurable for prior illness. And with the COVID-19, this is even more troubling. It is the ultimate pre-existing condition. The virus attacks multiple organ systems, our clotting system, our immune systems, rendering our entire body a pre-existing condition. In 12 days, the 8th open enrollment period for the ACA exchanges will commence. Despite the efforts of repeal, despite the refusal of Congress to build on the law, despite continued negligence and sabotage, millions of Americans will get health insurance coverage for their families. And Americans do not understand why protecting their families is controversial and has been opposed at every turn by this administration. Americans would like nothing more than for the bipartisan fighting over their health to stop. At times like these, people expect the support of their government, not making their lives more challenging. All people ask is to be able to care for their families, keep them healthy, and not fear bankruptcy at the first sign of illness. They certainly would like to stop fearing the very government they elect. In this country, that should not be too much to ask.
Thank you, Mr. Slavitt. We appreciate your presentation today. Now I'm going to call on our last witness, Mr. Pope. And Mr. Pope, you have 5 minutes. Try to summarize, and we're honored to have you here.
Thank you, sir. Chairman Pascal, Ranking Member Kelly, thank you for the opportunity to appear before the Ways and Means Oversight Subcommittee hearing on expanding health insurance coverage to more Americans. As the American people prepare to head to the polls, the committee is doing them an important service by taking time to review the arguments made over the past 4 years, the claims made against them, and the evidence regarding how they've worked out. Now, it's clear that the Affordable Care Act subsidies expand as necessary to guarantee coverage to individuals with pre-existing conditions, But the Affordable Care Act wasn't just subsidies to protect people with pre-existing conditions, but also a dysfunctional change in insurance market rules. The Affordable Care Act required insurance to be priced the same for people who waited until they got sick before purchasing insurance, as it was for people who signed up before they got sick. This had the obvious consequence that premiums spiraled up, deductibles soared, insurers panicked, tried to restrict their networks. Many dropped out of the insurance industry, or at least the individual market altogether. And we've been left with a situation when 4 years ago, the average premium plus deductibles, the amount of money that a family would pay to get coverage would be $22,000 before they had any medical care paid for. That's not an attractive insurance market. It's not something that's going to be appealing. It's least of all a success. It was an urgent necessity to establish an alternative source of coverage and a source of appropriately priced insurance, which give people value if they signed up before they get sick, something that's priced in proportion to their risk and in proportion to their needs, and that basically rewards them for signing up prudently in a timely manner. The short-term limited duration market was not perfect, but it was the best opportunity to do this. And for this, individuals who enroll in the STLDI market are able to get better benefits at the same price, for the same price that they would at the Affordable Care Act, and a much cheaper price for the cheapest available plans. At the same price for equivalent ACA plans, they will find better networks, and these plans have higher satisfaction ratings. So the administration was right to try and make STLDI plans more available. Congress is also right in repealing the mandate, or at least zeroing it out. The mandate had proven ineffective, and because so many exemptions are being created under the Obama administration, what remained of it was really just an unfair and inequitable tax. A lot of claims were made that the sky was going to fall if the mandate was zeroed out and if STLDI plans were allowed to be made available to Americans. None of these predictions came true at all. We were told the premiums would soar. In fact, they soared before the mandate was repealed, and since the mandate has been eliminated, premiums have been stable, in fact, slightly reducing. Enrollment itself has also been stable in the ACA market since the mandate has been zeroed out. So has been the effect with the STLDI deregulation. STLDI deregulation, if you look at the states where plans have been made available, premiums on the ACA market haven't soared or increased, and enrollment hasn't plummeted in STLDI states any more than it has in non-STLDI states. There has been no discernible harm whatsoever to the ACA market from the provision of STLDI plans. All that has happened is that millions of Americans have been able to buy affordable insurance, the majority of which would have otherwise been uninsured. There are flaws with STLDI plans. This was nobody's idea of a perfect insurance market. It was the best that could be done in a regulatory framework that had been established by the Affordable Care Act. Restricting plan term lengths to 3 months, as had been done under the Obama administration, creates a huge incentive for short-termism and for plans to restrict long-term coverage of chronic conditions. These are real problems. They are best solved by guaranteeing renewability for plans over the long run, eliminating restrictions on guaranteed renewability of short-term plans so that if an individual develops a major chronic condition while enrolled in the short-term plan, the insurer has to cover it this year, next year, and into the future. Under proposals to restrict short-term plan renewability, as prevailed under the Obama administration, if an individual enrolled in an STLDI plan got cancer, the insurer would actually be forced to drop them from coverage and would be banned essentially from covering them again. That's exactly the wrong way to proceed. We should protect consumers, not eliminate options from them.
Mr. Pope, thank you so much for your presentation. We appreciate it. And at this time, I will open the hearing for questions. Without objection, each member will be recognized for 5 minutes to question our witnesses. If the witnesses will respond with short and concise answers, all members should be able to ask questions. As mentioned earlier, we will not observe the Gibbons rule in this remote setting. We'll instead go to the order of seniority for questioning. alternating between minority and majority, beginning with members of the Oversight Committee. Members are reminded to unmute yourselves when you are recognized for your 5 minutes. I'll begin by recognizing myself. And Mr. Pope, let me just have a quick question before I start my questions, which I had prepared. Do you advocate that we eliminate or that the courts eliminate the ACA?
No,
Is that what you're advocating?
that's not what I'm advocating, no.
You're not advocating that. That's interesting. Thank you. I have a question. The question is for the entire panel. Please answer with a simple yes or no. The nation continues to battle the coronavirus pandemic with over 8 million cases and more than 220,000 deaths. Too many families are struggling to make ends meet. Do you agree that access to health insurance is more important than ever amidst the ongoing coronavirus pandemic? And I will start with the commissioner. Yes or no, Mr. Patterson?
For Mr. Patterson in Colorado, the answer is yes.
Ask now, Karibe?
Yes, Chairman. The answer for New Jersey is yes.
Mr. Slavitt?
Yes, Mr. Chairman.
Mr. Pope?
Yes, Mr. Chairman.
Thank you. Commissioner, why did New Jersey decide to establish a state-based marketplace rather than relying on the federally facilitated marketplace?
Thank you, Chairman, for that question. As I mentioned previously, we were sending funds to Washington, and the money that we were sending, we weren't being able to utilize it properly. And on top of that, we were seeing policies that were coming out of Washington that was just creating confusion and making our job much more challenging. By keeping those funds in New Jersey, we're able to tailor it specifically to our residents. We've been able to use that money to improve and expand our navigators program, outreach, education.
Just explain the navigators quickly. Very briefly.
Yes, Chairman. The navigators are individuals, organizations in the communities that help our residents to enroll them on the exchange, to educate them about the exchange, to explain the exchange. We had one navigator in 2019 while under the government, under the federal platform, and we have managed to invest much more money now, $3.5 million, and expand it to 16 navigators for this coming open enrollment.
Thank you very much. Mr. Slavitt, how destructive would it be for the Supreme Court to overturn the Affordable Care Act during a pandemic?
Mr. Chairman, there's never a good time to take people's health care coverage away from them. But at a time when they are getting a mysterious illness that we don't even understand, when many, indeed, children and college students are getting an illness that appears to be asymptomatic, decades from now, they could develop things as like heart arrhythmia or asthma. Insurance companies will be able to deny coverage on the basis of pre-existing conditions if the Affordable Care Act is eliminated. A vast majority of Americans do not want to see the ACA eliminated, and I think it would be a significant mistake. But it might also add that in the pandemic, it's important that people are able to report their illnesses so that we can contact trace and prohibit the spread. Once people start to worry about insurance coverage again, they will not disclose their illnesses, and the virus will spread even more rapidly.
Is this Mr. Slavitt, is this an exaggeration on my part that during the pandemic, millions of people lost their jobs and many of them lost their insurance? Is that an exaggeration? Is that hyperbole?
No, in fact, press reports and data analysis suggests you're exactly right, Mr. Chairman.
Well, what's going to happen to these folks if the Supreme Court says that's enough, no more of this?
I think Americans will go into bankruptcy. They'll avoid getting medical care. We'll be back to where we were in the early 2000s, but worse, with a disease spreading around the country nearly unchecked.
And finally, have you seen the Republican plan to replace the ACA?
I have not.
Thank you, Mr. Slavitt. I appreciate that. I want to recognize my friend, Mr. Kelly, for 5 minutes to ask his questions.
Thanks, Chairman. I appreciate it. First of all, I'm a small employer myself, and we do provide insurance for the people that are on our team. And I would just suggest that most small employers really look at their workforce as family, not as some unimaginable group of people. They are the people we work at their day with for mutual success. I just want to go over one thing now. In Mr. Slavitt's written testimony, he says that there's 14.6 million Americans that, and here's the key, may have lost employer-sponsored insurance since the pandemic began. But according to the CPO, about 3.9 million people are dealing with permanent job loss and had an offer of employment-based insurance. So of those 3.9 million Americans that may have permanently lost their job, I'm saying may have, 1.3 million are estimated to be uninsured. So a third of those are estimated to be uninsured, while others have obtained new coverage. So, I mean, listen, there's no question this pandemic's been a strain on all of us. But I want to address one of the myths that the administration is trying to sabotage the ACA. The Trump administration and House Republicans have committed to providing the health insurance options that Americans want and need. Now, any indication that this administration is sabotaging the Affordable Care Act is simply not supported by the facts. Healthcare premiums are down, right? Choices are up. Competition between insurers is up. And Republicans have confirmed time and time again our support for protections for those with pre-existing conditions. So I wish we'd quit saying that's not the Republican plan. It absolutely is. Now, despite that, there's still a lot of issues plaguing our system and making it unaffordable for many. So, Mr. Pope, as an expert, do you think this is an issue that should be solved by Washington? And if not, what can our Congress be doing today to bring down the rising costs throughout the entire healthcare sector?
Well, that's a great question. The big problem with the Affordable Care Act is it essentially said you can have any health plan you want so long as it's Obamacare. And that's not real choice. There has to be a broader array of choices, and it can't just be that there are plans that are out there that are priced the same if you sign up after you get sick as before you get sick. People need to be able to have a reward for signing up early, get a good value plan that is priced appropriately for someone who's doing the prudent thing. And if we make available options to individuals who are prudently signing up early for coverage, then as they develop a condition, it won't even have become a pre-existing condition because they will always have had insurance coverage.
Right. Well, thanks. You know what? One of the things I want to point out that as part of the Health Association Plan Act of 2019, both House Republicans and Senate Republicans were talking about allowing people to actually become part of association health plans. That means they could spread the risk of the health insurance loss across a larger number of people and access the same lower cost and high quality health coverage as large employers have and unions have. Now, Democrats in several states have actually sued to block this rule change. So, Mr. Pope, can you tell us about why association health plans are a potential benefit to small businesses and sole proprietors and the self-employed? It's a huge issue.
Yeah, so if you look at where has traditionally been the strongest health insurance coverage in America, it's traditionally been large employers. And that's in large part because large employers are exempt from a lot of state regulation under ERISA. So association health plans allow smaller employers to bundle together and basically set up associations, as the name would suggest, basically benefits from some of the same regulatory freedom and flexibility in pooling health insurance costs that large employers have always been able to benefit from. So it really levels the playing field, allows small employers to do what big businesses have always been able to do.
Yeah, I appreciate that. Again, as a small employer myself, there's nothing more valuable to us than the people that come to work every day that we can have mutual success. So I thank you for being here, and all the panelists, thank you for being here today. One thing I want to point out, the Supreme Court future action, it really is about the constitutionality of the Affordable Care Act. Let's make sure that we actually put that in the right light. So, Mr. Chairman, thank you for the opportunity to have an exchange with our panel, and I yield back.
Thank you, Mr. Kelly. And now the chair recognizes Ms. Delbene for 5 minutes.
Thank you, Mr. Chairman. Thanks for convening this very important hearing, and I want to thank all of our witnesses for joining us today. During a global pandemic of such devastation, it's critical that we turn our attention to maximizing healthcare coverage throughout the country through opportunities that were created by the Affordable Care Act. Mr. Patterson, like Colorado, the Washington State Health Exchange has been quite successful. In fact, earlier this month, Washington Health Plan Finder announced that the